So that's the cognitive, that's the emotional and behavioral factors. So mental health is a state of being in which a person is able to, first of all, realize his or her own potential. That person is able to cope with normal stresses of life. That person is able to contribute to society. He can be productive. So that's the state of being when we speak of it's a mental health.
Okay. Now, how is it developed? Because, like you said, it's a condition, I'm sure. How is it developed? Because somebody who's normal, they're doing everything normal. You go, they are behavior abnormal. What are some of the factors that lead to that?
Yeah, I would like to take that question straight, but with Bacon being a clinician, I will give it to you to start.
Let's Bacon answer that.
Yeah, okay. Thank you, Saba, for having us, and it's nice to be here. Well, sometimes when you talk about people having mental health problems, people think that is something from space or anywhere, but just from our day-to-day interactions. Sometimes you buy a car, for example, the car is moving fine, everything's okay, it has been tested, they say everything's fine, and suddenly something develops in it. So from our own body functions, normally, sometimes some of the nerves and other things in our system just, what should I say, have some accident and something happened, right? But most of the time it's from difficult upbringing.
Difficult upbringing. What do you mean?
Well, you see, the number one causative factor of mental illness is poverty. And when you live in an environment or a country that is really, really poor, like ours, you have kids at a very young age are, introduced to a lot of stress. Some of them have to sell to make ends meet for their family. Some of them are not in school, so they are not able to go to school because the parents and relatives are not able to provide for them, hunger. And there are lots and lots of things, but when you talk about difficult upbringing, it's just coming up in an environment that, poses stress, a lot of stress on you. And as you grow up in that kind of environment, it's not normal for you. As you grow up, you develop a lot of different thinkings and ways of doing things that affect you as a person. So that's what we actually look at as difficult upbringing.
But if you will attribute the development of some of the mental health problem to that, not too much young people, I'm sure, in Africa, not only Liberia, poverty is still rife, but not many young people you see who are suffering from mental health. If you would agree with me, the bulk of those who see suffering are people of adults. They're people who are in the adult age.
Well, it may seem that way because the actual research or findings are supposed to be done to actually come up with information regarding those. But mental health starts from a very young age. Very young age, yes. You're talking about 15, 12 upward. And sometimes when these things are starting, it's start like normal headache, normal malaria, normal illnesses that happen to you and myself. Okay? So, people don't see it at that time until it becomes chronic. Yeah, that's one. But I was just mentioning difficult upbringing, not as the only causative factor for mental health.
Okay.
You talk about illnesses, right? Even malaria. If you have cerebral malaria, it can introduce you to some form of mental disorder. Okay? You have stroke, pressure, you have diabetes. All of those other illnesses that you think about that people usually go to the hospital for, they have a contributing factor to mental problems. Okay? And besides, you talk about the bigger ones, even TB, HIV, at certain stages, it causes people to have mental health problems. Accidents.
Now, what are the symptoms? What are the signs?
If you don't mind, just to add up a little bit, referencing the issue with young people. Yes, back on said, statistically, more than half of mental health issues that people experience occur by the time they are in the age 14. That's the onset. And about 3/4 of that.
But why you
we're
don't
talking about-
then why you don't see them at that age in that condition?
That's a good question, because when we talk about mental illness, it exists on a spectrum. So it's not just one point place.
Okay.
I think where we get misled is that when we say mental health, we think about mental illness, we think about people who have very severe conditions, and we see them in the streets in Liberia. So then we say, okay, those people have mental health issues. But that's not really true. That's not the full picture.
Okay.
That's just a part of the picture.
A very small part.
A small part.
0.01
Yes, it's on a spectrum. So you have mild condition, you have moderate condition, and you have severe condition. And we only see that last extreme. We don't see significantly the moderate
The
or
mild.
yes. So at any point in time, it depends where you are within that continuum that you can snap.
Okay.
But my point here is to say that largely mental health issues occur in childhood and adolescent. So about 3/4 occur by the time you are in your mid-20s. Now what we see largely is just the manifestation of that thing when somebody is already old. So that's why it's important for us to consider trying to do as much as possible to address mental health issues from all levels, including from childhood.
Okay, now you spoke about the 3 stages: the mild, the moderate, and the severe. Now let's look at the symptoms. There's this individual who may be developing mental health problem, and the person's in the mild. What sort of symptoms? What kind of signs does that person present?
Well, thank you, Saba. And like I said, the signs and symptoms begins just a common illnesses that we have around here. But maybe before I go there, if I would ask you, how many mothers, all right, that are not like having children or having child, that are crying for child every day? How many parents are unemployed that wants to send their children to school and can't do that? How many of our youth in this country that don't have employment since maybe they graduated from college, you know, and what have you? If you could take that survey, you will be surprised. And those are the areas, the psychological problems that actually push people towards, like he said, the spectrum. You are on this side, which is health. This is the inner side, and all you want to do is in the middle. But those conditions can actually push you towards the illness continuum. And before you look, sometimes you have headache. These chronic headaches. All right, lack of sleep. All right, bad dreams. It just begins with those things, and you will find out that people sometimes they say open more. Have you heard about open more in this country? I mean, an adult at a very old age stating to you that their scalp has opened again, and they are actually rubbing chalk. Sometimes they are going to the holy, the prayers and other areas. Okay, so those things. Okay, difficulty in thinking, concentration, being focused. Those are just the beginning. All right, and like he said, most of the time people only see mental illness or mental disorder in the 0.0% that are on the streets that have gone extreme and think. But if you could take a survey in homes in Liberia here, just in one community alone, there are many people will not sleep because they are worrying a lot about the next day hustle. People are worried a lot about family issues and other things, you know, how they are actually going to survive for the next month that coming. You know, as this thing piled up over and over time, you find out that people actually have those.
So essentially, you're trying to advise that people should stop the too much thinking. You know, even if you don't have it, just thank God and go to bed. Now let's look at the aspect of prevention. You indicated that the mental health problem starts especially from the age of 14, 13. How do we prevent it as a country, as a people? Because you still see that happening over and over again. There are people who are developing the problem. So how do we prevent it?
Yeah, thank you. First, I would just like to re-emphasize that everyone is at risk of having mental health issues. So no one is completely free of that. Now, irrespective of your age, irrespective of your gender, your ethnic background, so you face that. But some of the conditions that Bakon mentioned are things that could increase the risk factor. Are things that will increase the chances of actually getting mental health problems. They don't necessarily mean that once you face the risk means that you're going to have it, but they just increase that likelihood. So that's one. And he mentioned also anxiety issues and depression. So those really are two of the most common mental health issues. So
Anxiety and depression.
Anxiety and depression combined, the productivity loss associated with them is up to $1 trillion every year.
Every year.
Yes. And
globally?
So, yes. Globally, up to $1 trillion globally. So that's why understanding the signs and symptoms, understanding preventive measures, and I like your question, which I'm going to address. It's very important so that we can be able to reduce, alleviate these problems. So one point I would like to make when it comes to how we can prevent this and how we can promote better mental health in the society is by first working on our attitude. And mainly I'm talking about stigma. Stigma, discrimination, and neglect are very important because they contribute significantly to negative health outcomes for persons with mental health issues. Because they prevent them from, first of all, either disclosing or presenting to health facilities for treatment because they don't want to be looked at as the outcast. So the stigma is not just at the individual level, it's also at the community level. Communities reject mental health programs that could be there to support persons with mental health issues. It's also at the family level. Families are rejecting their loved ones because they don't want to be associated with them because they have this. So we have created this very negative picture of mental health and mental illness. We equate them to be a very bad thing and people suffer. So we need to first of all work on that.
Changing our attitude.
Changing our attitude. We have to be open. We have to be compassionate. We have to accept people and work with them so that they can be able to accept their condition. Because when we stigmatize them, they can in turn stigmatize themselves. And so you have issues like depression. Somebody start to experience very low self-worth. Somebody start to lose interest in things that they were good at, things that they loved before. And this can lead to disability issues because they don't want to be productive or they don't feel that need to be productive. So that's one. We need to look at that. The other thing we need to do is there is a wrong perception about mental illness. People believe that it cannot be treated. No. The wide range of mental illnesses can be treated. Yes, it is true that some people will live with these conditions for the rest of their lives, but that does not mean that they cannot be stable and they cannot be productive like you and myself.
Okay.
So treatment exists. We need to refer people to the places that are qualified to provide treatment. So there are mental health professionals in this country. We know that we don't have a lot. There's also the issue of say manpower. But however, the minimum services we have, we need to encourage people to use them.
Okay.
Yes. And when they do, I give you some stats on that. More than 80%, when treatment is proper, is combined with say medication and the proper psychotherapies, more than 80% of people with schizophrenia, which is a major mental health issue, it's a psychosis, can be free of relapses within 1 year of the treatment. And I tell you, up to 60% of people with depression can recover. And up to 70% of people with epilepsy can be seizure-free. Now, that's a neurological condition. And when we talk about mental health in general, we talk about three main groups. We talk about mental health, we talk about neurological issues, and we also talk about substance use disorder. So they combine from the WHO and the Global Mental Health Body to focus on MNS because the same situation that affect mental health is also affect issues with persons with epilepsy.
Okay.
And I tell you, it's important because the case intake that we see, data that come from across the country, presented by mental health clinicians or mental health facilities, and whether by international organizations or government facilities, we are seeing a significant proportion of people that have seizure-related issues. At least 50% of the cases are cases of epilepsy. So it is important for us to know, for us to promote treatment. People can seek treatment and they can be helped.
Okay.
I would also like to talk about moving away from the whole concept of institutionalization. That we should have a very big place and we should grab these people wherever they are and just lock them up. That's not what the evidence is showing us. That's not best practice. We need to move away from that, because when we do that, there are human rights issues associated with that. There are issues of poor or ineffective rehabilitation. There are issues of people not developing the proper social skills. We need to move towards community-based mental health services.
Okay.
We need to move towards integrating mental health services into routine services, into general health care. That's where we need to go, so that the healthcare workers at the clinic level, at the hospital level, will have multiple skills that they will be able to provide you of that kind of treatment and do your proper assessment. And they exist. Now, that system of architecture is so important because it helps to reduce stigma. If you have a big house here, we know that there where we house all the so-called crazy people. So we know, right? If you went there, anybody walked around there, they'll say, oh yeah, that's a crazy man. But if the system is within the facility that I present to the hospital, that I don't necessarily have to have a severe condition. Now, when I have severe condition, then you want to make sure that people are placed in such environment. But that environment is not focused on just big institution sitting by itself. So people who are on the left side of the spectrum can still be able to access, can still be assessed by clinicians and early detection, and they can be provided services so that they don't fall on the right extreme.
Wow. Now, you said, you wanted to add, because
I mean, Ben had nearly said it all, but mental health, I mean, is one of the neglected public health areas.
They were our coming.
But yes,
because the Carter Center and the WHO, yes, you are knowledgeable and you know what you've told us as to what we need to do to prevent it. You understand the program very well. How are you now? They're both institutions. You are global institution. The World Health Organization, the Carter Center. How are you helping our people at the mental health division at the mental health in trying to educate them and improve the program?
Okay. A lot has been done. So, from a few years back, when we had only one psychiatrist and we did not have mental health clinicians, to work in those areas to help improve people's lives. We have graduated from that, and I think Ben will say more on that. But like he's saying, for example, you have like 3 million people dying from harmful use of alcohol every year. If you talk to the street of Liberia on the holidays all the time, there were a time, I don't know, they used to call it walking about Friday, and you see students leaving from school to go and drink alcohol and make merry on the beach. And he just stated that a significant proportion of people with mental problems begins at age 14. Okay, and we have our case in school. I don't know whether you heard about the tramadol issue some times ago. All right, so those things are chronic and they are here. Every 40 seconds, you and myself say that globally somebody died from suicide. Yeah, it looked like a taboo, but we know that in our community, from time to time, we hear, oh, this man killed himself, or this woman killed herself and killed his wife, and those kind of things we hear it from time to time. All right, so I mean, the Carter Center is our very good partner. We have partnered together on a lot of things, nearly everything as it relates to mental health in Liberia, and we have done a lot. Mainly,
when you say done a lot, can you pinpoint to something that,
for example, you need policy documents to educate people, to help the government, right? So, with the help of other partners, all right, we have developed some good policy documents. You're talking about, for example, we now have a mental health law. And there are a lot of countries around us here that don't even have a mental health law. But Liberia have developed a mental health law, which is a significant, achievement. All right, and all of us play our part to actually get that done. We have the mental health policy and strategy from 2016 to 2021.
Okay.
And that is where we have all our programs and how we see mental health, where we want to go. All right. In there, we have like some 23 million, I think 23.1 million, that was forecast to be able to work and bring mental health in this country to a level like the modern world, like the Western world.
Okay.
Unfortunately, we have not received a significant portion of that funding to be able to do anything. But I can tell you, mental health clinicians have been trained. He's talking about even nurses and PAs that are not even mental health clinicians have been trained in the 15 countries as we speak. Those people are able to at least detect mental health problems and be able to make referrals, be able to give a basic management. All right, so any part of this country that you go now, you will see a mental health clinician or a nurse or PA that have been trained to manage people with mental health problems. Okay. In that plan also, we say, like you say, we want to take mental health from the institution and put it to the community. Primary health care is the way to go. I mean, what he just explained is actually the integration of mental health into primary health care, wherein this person with mental health issue or with any other problem doesn't have to go to the institution or mental health where they will be stigmatized and things, but they should go through the same health care like the person with malaria and everything. People may say it's expensive, and those people sometimes they on medication for the rest of it. How about someone with pressure? A person with hypertension, they are on medication for the rest of their life. A person with diabetes, something about diabetes, they are on medication for the rest of their lives. All right? So, it's just the stigma that have been attached to the thing. So, I can see wherein when somebody has pressure or when somebody has malaria, they walk in a place and be received and they take their medication, they treat them well. But when someone and when someone bring it sick, I equate it to the person being sick. How can you say every part of our body is okay for that person, for each part of that body to be sick, but when the brain is sick, then it becomes a problem.
Okay.
Everybody looks at it as a problem, but the brain is a backbone. We are all sitting here and do these things because we have a right thinking. You see, like he said, mental health is just how we think, how we behave, looking at our cultural norms, being happy and bringing happiness to other people and all of those things. You see, so if it comes to policy document, we have done a lot. We are by far ahead of most countries around us. When it comes to training, we have done a lot. And like psychiatrists, we now have like 3 psychiatrists here. Some are already in training. I think Liberia is supposed to, in the shortest possible time, have the 5 psychiatrists. Okay. So I think we are moving somewhere. But more needs to be done.
Surely.
More needs to be done. All right? Because if you take the issue of substance use, substance abuse alone in this country, now mind you, there are statistics that says that, 1 in every 4 person will have a mental health issue. But WHO says when there are problems, emergency, wars, you can times that by 3. All right? We had a war. We are still struggling from the impact of the war. We have Ebola. Now we have COVID. And believe me, this virus, a lot of people don't know what it is. And believe me, whenever a virus comes into our body, it leaves a lot of things behind.
Sure.
You and myself don't know now, but I wouldn't be surprised tomorrow when people start to show some signs and symptoms, mental health issues as it relate from COVID infection. That can happen for sure. Okay, so if you're looking at those statistics, all right, you are talking about thousands of Liberians, now having mental health issues that needs to be addressed. So the policy documents, the trainings, and the resources have been put into this place, collaboration between partners, and based on that, like I said, we are actually having those things, but we are staying sharp.
Okay. Now, you're listening to the Bumper Show rated on the OBC 99.9 and other frequencies across Liberia. We are discussing with Mr. S. Benedict Dawson. He's the program lead for mental health at the Carter Center. We also have Mr. Bacon DUA. DUA is the non-communicable disease focal point at the WHO. Now, from what all of the both of you said, I think the idea that you're trying to propound to us is the issue of integrating mental health into our routine services.
Exactly.
Now, to do that, I'm sure our Minister of Health is listening. Those who are responsible to run the health sectors are listening. To do that, what do we need to do first? Ensuring that we integrate mental health into our routine services. That somebody who maybe the child will consider as a crazy man can walk to Redemption Hospital, where he has his family, and receive treatment. So what do we need to do? Build the capacity for us of the hospitals or what?
Great question. And that just brings me to point out the theme for this year's World Mental Health Day.
Mm-hmm.
It's all about investing in mental health. It's all about increasing access. So to do that, we need to invest in mental health.
Okay.
Yes. And that means investing in training more mental health professionals. We've tried. We have a national mental health policy. Now, just supporting the implementation, the full implementation of that policy alone will take us a long way. But again, for a long time, investment towards mental health is just bad. Now, this is not just about Liberia. This is a global issue. Yes, this is a global issue. A significant proportion of countries worldwide do not invest in mental health as is expected.
Why?
Okay, so it points to many things. First, one of the things is that we can say some of the investment are largely driven by, I don't know, you can call it the maybe top ranking or hotspots issues that are very attractive. Mental health isn't attractive. It's not sexy, as you say, for people to look into. And there's also the notion that mental health and investing in mental health is complicated because you don't have a particular condition like you have malaria, and you know clearly what the assessment of malaria will entail and what the treatment would be. But mental health is a whole spectrum, and mental illness, whole spectrum of disorders that people say, okay, it's hard to work together with having so many groups. But what we know, it's different. What I can tell you that the evidence is there to show that just $1 investment in mental health has a return of up to $5. And the evidence is also there to show that many countries, less than half of them, or more than half of them, have not even spent about 1% of their health budget on mental health. Now, this World Mental Health Day is all about that. If we want to improve the system, I would say from a Liberia point of view, we have mental health policy. That's one good place to start from. The policy is clear, very clear, that is based on best practice and evidence of everything. We need to support that. Increasing the workforce, the competence and the number of mental health professionals in the country at different levels. We need more psychiatrists. We need more clinical psychologists. We need more clinical social workers. We need more mental health clinicians. We need other specialized mental health workers, like more child and adolescent mental health clinicians. So we even need more training for community volunteers or community health assistants or even community health services supervisor at that level that would take it from the community health system level. So we need to increase that. We need to create more wellness units. That's what our policy said. Our policy said there should be at least one wellness unit at each county hospital in the country.
Okay.
Today, we have about 4. There are still more. Because when we do that, we will reduce the burden on Grant Hospital. Now, Grant is the only, is a national referral hospital for mental health issues. Now, wherever you are, whether in Maryland or Grand G, Lofa, whatever, that's the referral place. But if we're able to set up substation, to say at the county hospital, we will be able to at least reduce that burden. If we're able to increase the number of workers and integrate mental health services at the routine care level, we will be able to reduce that, because grant cannot take it all alone. And what happens, which is bad for mental health, as we were saying, because the more it is untreated, the worse it becomes, the more debilitating it is. And again, for low and middle income countries, up to 75% of people go without treatment. Up to 75% go without treatment. So Liberia falls clearly in that category. We have about 75% of our people who have issues cannot be treated. So this means increasing access for them.
And that's the theme of this year's celebration.
Greater investment, greater access.
Mental health for all, yeah.
Now, when you talk about greater investment in mental health, what is, if you were to look at the budget, because I'm sure the both of you are in Liberia and you follow a lot of the debates regarding our budget and all of that, what specific percentage you think you can put to mental health, maybe of our budget, so that we don't create a situation where people develop mental health and they go without treatment, because we know if it continues that way, it will continue to affect our human resource capacity. Because those people who are affected and going without treatment, they are significant people. And some of them, they could help in nation building.
So again, so thank you. That's a very good question. Like Ben said, majority of the countries around the world invest in less than 1% or maybe 1% of their budget in mental health. If you could look at that, compare, and you bring it to our setting, well, it's actually nothing. All right. Like I said, in our budget, you have like the mental health guidelines. You have like I think 23.1 million. All right, and you have 15 supposed to go to infrastructure, like he said, taking people away from the institutions and building those mental health units. Okay, so if we are able to do that, the promotion we are talking about, it will be from county to county. People in whether you find yourself in Bogonjiria and every other place, if you have the mental health clinicians with the units, they are able to create that awareness. They are able to talk, from time to time. Okay, and when we talk about investment, sometimes it actually begins with the individuals. As we look at our own mental health, all right, we're talking about businesses, all right. Can you imagine where we would have been if some of the GSM companies and other people say, look, just 5 cents for every call or for every car that we sell, we are going to take 5 cents to invest into mental health. This problem is solved. The issue of funding will be solved right there. I can tell you that. All right. So we are looking at the businesses, universities supporting their teachers, school and supporting their teachers, family coming together to help, one another. Those are all part of investment. It's not just a huge money that maybe we will get from the government in other areas. But when we talk about investment,
looking at
your own. I mean, we sell a lot of alcohol in this country, right? And they are harmful. So the WHO guidelines say, look, increase the taxes on alcohol. Increase the taxes on tobacco. All right? And the tobacco industries, they are very smart, right? People used to smoke the cigarettes you see there on the street, but they target the youth. They say, send your closing down our factories with a cigarette and thing. Now we are going to bring shisha. Look around the place. Which one of the youth that goes on party and thing that do not want to smoke shisha?
Can you imagine?
All right? But that is 3 times more dangerous than even a cigarette. Can you imagine? Do you know the health and longevity of our youth as they engage into the act from time to time? Okay, so if you add 5 cents on a bus or a cigarette or on a shisha or on, in fact, those things, it should gradually be increased to the level of bounding, because the mental health issues that we are talking about, those are really contributing factors to people developing mental health. So we look at the businesses, we look at society as a whole. How you yourself take care of your own self is investing into mental health.
Sure.
Because if you are able to prevent, you yourself coming down and your children, you pass it on to them, well, you will actually be reducing cause of mental health issues in the future.
Now,
Yeah, if I can just add to that. So, I would like to say, share information that the government is currently doing a mental health financing study.
okay.
And that study will help us to better understand and address the question you asked, how much of the health budget can we allocate to mental health. So, yeah. And I also like to point out that though we speak for greater investment in mental health to promote greater access, we are not blind to the fact that the government is constrained. Okay, we are not blind to the fact that there are competing health priorities, and we are not saying don't invest in HIV, in malaria, in maternal health. That's not what we are saying. We're just saying do more for mental health. And we also know as a government that a major contribution of our health expenditure or global national budget, comes from donors.
Okay.
So we know that, and we know that donors have priorities, and government has to really work hard to shift some of those priorities to national issues. So we understand, everything, yeah. But we are saying that just government should do more, because doing more in mental health, like I said before, investing in mental health speaks more about the investment on the individual, the investment on the larger society, than just quantifying the financial number or so.
Okay.
It's more than that.
Okay, now shortly I'll be opening the line so that we have people interacting with us. One HO problem that I know mental health continues to face is the issue of stock out. Drugs for our people often not available or limited in supply. How, looking at doing our own analysis and looking at the picture of our mental health problem, how is this affecting our efforts, outweighing our efforts to improve our mental health problem, the issue of stock out?
I would say negatively, and it's serious. But first of all, let me clear, drug stock out is not just on mental health.
Okay.
A lot of other drugs as well. Just to be fair, so we're so biased towards mental health. But we are here to talk about mental health, by the way, so they should allow us to be biased to that extent. Yes. So, yes. So, drug stock out is bad. Now, for mental health, persons with mental health problems, one of the main reasons why it's bad is that they can relapse.
Okay.
Because
the drugs are not available.
Yes. They have fixed regimen. They have to take a certain drug at a certain time, because we want them to be just like us. We want them to be stable. We want them to be productive. And once they don't have the drug, then they go back. And what happens is that to get them to come back to normal may also mean increase, or dosage. So it has other effect, on them. And some of the drugs they take are they're not very comfortable. That's not something that they really enjoy taking, but it helps. So it's important for us to work against that as much as possible. So, but the investment, improving the investment in mental health, will definitely improve, address the issue of drug stock out. The partners are working. There are many international organizations here that contribute, small towards that. Okay, they bring in drugs, they help the Ministry of Health and the government sometimes to allocate money towards that to get some drugs. But it's a big issue that the Ministry of Health has been faced with for long, like you say, HO. But partners are working towards it, government working towards it. We think that if we just increase investment, in mental health, we will be able to address these issues.
And maybe someone just to add a little bit, you know, you could just imagine a person that is on hypertensive medication, they have pressure. If they don't take their medication for some time, what happens? The pressure goes up and they die. So too with this mental health issue. There are times that you see that people are going to quantify medications for the whole health of everybody, and you see like only one component or nothing at all as it relates to mental health medications. Yeah, and then you hear people as crying from every country. The clinicians are calling, "Oh, my patients were doing well. They have relapsed." So I tell you this: there are celebrities around the world. There are a president, even United States presidents, that have given interview and that have actually stated, documented that they suffer mental health problems. But because of the support that they are able to function. I will name like one celebrity, Jean-Claude Van Damme. He posted, and if you read on his story, he's a documented bipolar person. All right, bipolar disorder, wherein you see person move shift from being calm at one point, and before you look, they are on the other end, and they are very talkative or move a lot with a lot of energy to do things. That's a mental health problem. Okay, he suffers that, but he's able to function, and he's a millionaire because what? He has a rep support. I can tell you, support. Everyone that you see in the street, they can function to a certain level if they receive the rep support. Some to a certain degree, you won't even know that they ever suffer mental health problem. Okay, because the thing is an imbalance. Our whole life and things we do most of the time, it comes from the chemicals that run into our brain, right? Now, there are sometimes illnesses, no matter what they cause, but there comes an imbalance. Whether you have been taking drugs, whether you had an accident, your head, hit on something, and whatever the cause may be, that imbalance needs to be helped by something that you put there. All right. So whenever that which is a medication, the psychotropics are not there, you find out that people will relapse. But people with mental health issues are able to contribute significantly to the productivity that this country is lacking, to the productivity of everything that we do, if only we can care for them. So it is now time that we have been doing a lot, even with the Carter Center. They talk with other pharmaceutical industries in the States and everywhere. They are chipping in, some donations. But that is not enough. We need to have a system in place, right? Wherein the procurement of medication for the Ministry of Health is equally distributed. Equity. You see, we have a universal health package, right? Leaving no one behind. Everyone everywhere, which is also part of this theme of this year. Everyone everywhere, right? Leaving no one behind. Now, if you say people that suffer from mental health problems, they are not important, you are not going to achieve the goal of universal health coverage, a document that you sign as a country, right? So, if we are to look at the UHC, which is a universal health coverage, providing health for all without significant cost, without high cost. Okay, we really need to look at the issue of medicine and psychotropics in this country. Yeah.
Now, gentlemen, let me hold you on this one. Often we see people loudly speaking, like all of you today, and increasing your advocacy, especially when the anniversary, when the day to celebrate is around the corner or is about to. But then after the celebration, we all go back into our slumber. How sure are we, gentlemen, that with this celebration, that with this theme, greater investment and greater access, everyone everywhere in mental health, how sure are we that you are going to continue with this sort of advocacy, with this sort of loud speaking you are today, ranting about mental health issues?
Okay. So, first of all, this advocacy is part of our work.
Okay.
Yes. You may not hear us on the radio every time, but we are doing it every day. So, mental health, like I said, it's not a very attractive area. So, to be working in that area, you have to be an advocate for all your life.
You have to be passionate about that.
Yes, you have to be passionate. You have to fight for access. You have to fight. So that's what we do every day. So I can tell you after this, we are still going to continue doing it.
Okay.
But what I would like to point out is that now, this is an opportunity to increase awareness
Okay.
on mental health. One, there's also an opportunity to call on world leaders, to call on the private sector, to call on everyone else to focus on mental health and increase investment
Okay.
in mental health.
It's a call to action.
Yes. So, and it's also important to know that many years, the elevated platform that mental health has now wasn't like that maybe 10 years or so ago. But gradually, attention has been shifted towards mental health. So it is gaining traction. Now, last year, there were a lot of activities ongoing, all in Europe, promoting this. So there was the Interministerial Conference in the Netherlands that brought government leaders from world leaders from everywhere to talk about this. Now, Liberia was represented, and Madam Noble, Minister Noble Howard, eloquently spoke on the issues. So there were also the World Mental Health Forum, which is something that goes on every year. And there is a united campaign ongoing for mental health. And that campaign has been sustained, over the years. And we are not stopping that campaign. So it will continue. Now, it's also important to know that this is not just about us working for the INGO. It's also about persons with mental health issues who are also a part of the advocacy. And they are the focus. They are the strongest link in the advocacy, not us. I'll tell you, today, the legislation we have, the mental health budget that was passed by the House last year, and the policy issues that we are articulating and fighting for, those things can all be attributed to the force from persons with mental health conditions who are stable, who manage an organization themselves, who come on public, they come in public, they are internationally represented, they are talking about this, not just us. Liberia has one of the strongest mental health service users movement in the world. Cultivation for Users Hope.
Okay.
They have been represented at all levels. So even if we don't do it, they will do it because it is their passion. It is their life. They are persons with lived experience, and there is nobody better to articulate their issues than these people.
Okay.
And maybe just to add a little bit, if you look at the cause of death globally, it comes from the non-communicable disease now. It's no longer HIV/AIDS. It's no longer malaria. Even though our own situation in Liberia may be a little bit different,
Sure.
but if you look at the global issue, all right, death from accident alone is more than some people now dying from AIDS, HIV. So the attention has been shifted, to actually these non-communicable diseases, including mental health. And maybe I will say a little bit from our own angle, the issue, there is a huge platform now we are pushing. Why are you going to put a whole funding mechanism in place for HIV? You are going to put a funding mechanism in place for TB, but not mental health. Okay, or not NCD. And you know that the whole thing has shifted. People that are dying from these things, they are more than those people. So it's now time that our attention be shifted to this end. And I tell you, like he said, it is ongoing. I mean, we are now trying to create a funding line for NCD. Mental health is included to a greater extent.
That's
there are
good.
a lot of different, policy documents that have been developed. Conferences been held. And in fact, we have gotten to the point saying, well, enough talking. Where's the action? Where's the money? That's the question now we are asking.
Surely.
Yeah. And that's the same thing that is going on here. before we could get our budgets passed and think these guys that he's talking about, we work with them. We have been with them for a very long time. They have to march to the Capitol building there with placards and everything. Yes, I'm a person with mental health problem, but I have a company, I'm supporting my family, and I'm doing well. Okay, so why neglect me? And at least for the first time we had that budget passed, thanks to the government, and now we are saying, well, yes, you put smart in there, it's not enough. Let's
We need
increase
more.
it. Yeah.
Okay.
So you say, Saba, just that point. Why it is not right, it is not helpful to us when we exclude persons with mental health issues. Because clearly, I'll say, the national budget today, they were influential. So when we exclude people, not only do we deny them of the rights and opportunities they are expected or legally entitled to benefit from society, we also deny ourselves from benefiting from their expertise, from the fruit of their labor. So we can boast now that we have it now. It's not a very big amount, but it's there because they were there, because they worked towards it. Mental, neurological, and substance use disorder. Now, looking at the entire global burden of disease, we are talking about more than 10%. Yes, more than 10%. So, it is an issue. We are not just making the case or coming up with these things, but it is an issue
that we need to address. Now, listening to the Bumper Show very, very shortly, opening the lines. I know you indicated that the pending celebration is a call to action, and we just want to know some of the activities before opening the lines, some of the activities marking the celebration. How many days and what are those things that you're going to do?
Usually, the entire October, it's for that. So, organizations and all partners involved, will have series of activities throughout the year. Yes. So for us, we're really in Liberia focusing on the main day from the 10th to the next week. But prior to that, we are here. So we started the whole advocacy on the radio since last week. A lot of the organizations involved and the Ministry of Health, they have been going around to different radio stations and talking about this. And today we're here. So that's one. We are carrying on the awareness, for this. And talking about mental health, and I like how you started this by asking what is mental health, what are the causes, what are the signs and symptoms, because that's the kind of education first we need to provide, and it also helps us to address some of the myths, the misconception and around this. So excellent. And so this is continuing. The other thing, there will be a visit to Grant Hospital. Grant on the 10th is hosting a fundraiser for mental health to be able to support some of the services that they have there. They are thinking more about promoting community services. Like I said, community service is the way to go, and we need to engage our community to be very receptive and accepting to persons with mental health issues. Once they understand the risk, they understand the issue that this is everybody's business, we can be able to get them on our side. So Grant is hosting this fundraiser, asking partners to attend, asking other government entities to come and support them. Okay, so let me reach the advocacy to you. Please go there on Saturday. LBS represent. Yes, please, and be a part of the process. This is for everybody. Yeah, we don't know when we can snap. At one point in time, we are there, and we don't know what's happening to us. So it's best for us now to create that environment that will support us when we get there.
Okay. Now, finally, before opening the lines, gentlemen, Carter Center and the WHO, what do you envisage in the next 5 years for mental health program? Let's hear from you first, and then WHO.
Okay. Thinking about, I would first of all like to commend the country. Okay, the level of work done so far. We were very far. We have a policy. Yeah, many countries don't have. We have a legislation. Many countries don't have. We have a mental health unit. We have a technical coordinating committee that is set to advise the ministry on the whole operations of mental health issue. That is important. We have that. We have increased our number of mental health professionals from just one psychiatrist, as our narrative used to say 10 years ago. Now we can speak to about 350 mental health clinicians. We can speak to subspecialty child and adolescent mental health clinicians. We can speak to over 500 healthcare workers trained in the WHO Mental Health Global Action Program integrated guidelines. We can speak to community volunteers and other people trained. So we have moved. We have made great strides, but still more to come. So in 5 years' time, what do I look to see? I expect to see greater investment. Now, one, we have a budget, right? Very small, about 25,000. That's a step. I expect to see that increase from what we are talking, from government effort with the financing study and government ability to engage more partners, to attract them to invest in it. I expect to see more of that. I expect to see more mental health professionals, because the current policy will be expired next year, and then there will be an evaluation and that policy will be revised. So that policy, in terms of the number of the workforce, the government have achieved a lot. So they will be increasing the number of professionals, and they will be directing resources towards other areas. I expect to also see more mental health more wellness units established across the country, because we need that. Yeah, I expect to see real force that the mental health service user movement in Liberia is fully supported, better, stronger. I expect to see more young people involved in the advocacy. Now, when we travel, we are really amazed sometimes by other countries. Let me just take Ghana and Nigeria. We have mental health service users like university students who come up and say, this is my issue, but I am back in school now. I've established my own business. I'm doing this because we are trying to break that stigma. We're trying to tell people that the person should not be judged by their condition. They are not their condition.
Surely.
There is still the personality. There is still the expertise. There is still that person capable of doing something. And we have seen this. So we want to see more young people involved in the process, articulating the issue, making the advocacy, so that you don't have to see us, like you're saying that. So you don't need to see us. You need to see the people who are involved. So they say, for us, there's nothing for us without us.
Okay. You said it all. Let's hear from you.
He said it all, really. And I really, within 5 years, I actually want to see that our legislators being fully aware of mental health, what it is.
Okay.
I really want them to understand that the productivity that is saved without addressing the issues of mental health in this country, they cannot really get that, because you have a lot of youth that are languishing out there, and what they engage in, only God knows. But we see the impact and the effect of what they do out there. They are the people that look at the budget. They are the people. I want them to actually see if there is not an increase in the budgetary allocation for mental health. For health budget may be there, but for that line, mental health in particular, they shouldn't pass it. Okay. I want to see community mental health to the fullest, where people with mental health issues are able to walk at the clinic and get the services that they need. Well, children with epilepsy are not thrown out of school because of their problem. Like Ben said, we have to see the individual. We want to get to that level where more people are able to come and discuss their issue and their successes they have had over time. We want to see that full support. Lastly, the collaboration. Increase collaboration with our partners. Okay, the stronger we are able to put all our limited resources together into one package, the stronger we can be, and the more we are able to do a lot of things.
You're listening to the Bumper Show right there on the OBC 99.9 and other frequencies across Liberia. It's your turn now to interact with my studio guests. I have Mr. S. Benedict Dawson. He's the program lead for mental health at the Carousel, and Mr. Bakon Doyle. Mr. Doyle is the non-communicable disease focal point person at the WHO. So it's a time now to interact with them on 0776 089 713. Today we are not looking at politics, we are looking at health. So put your calls on 0776 089 713. Let's do this call on the line quickly. Your name and where you calling from?
Hello, someone.
Yes, sir.
My name is Benjamin Bala.
Okay, let's hear from you.
Yeah, I'm a lived experience from mental health. So I must commend your studio girls. They said it all. But I think the legislature needs to be more proactive, exercising their oversight responsibility to make sure that they support the mental health budget. For the first time in the history of Liberia to have a small amount of money for mental health. And that has not even come into reality. We just heard it on paper. Only 2,000 of that amount have been used to clear the little drugs that were given by the Caribbean and other partners to the government. And our understanding for the service user end is that those drugs are not even psychotropic drugs. So I think the government needs to do more. You can't have somebody cleaning your house and then you, the house owner, and you're not doing anything about it. So we just have to say thank you to the Caribbean and other partners that are doing so well. Look at the issue of medication. There's no psychotropic medication for persons with mental health conditions. So those are issues that we need to look at. So I just say thank you, and I hope this will not be the last time that you always provide a platform at ELPC for mental health. Thank you so much.
Many thanks. 0776 089 713, or better still, 0880 514 096. That's the numbers to call, and you are live right here on the Bumper Show. 0776 089 713, or better still, 0880 514 096. We'll take this caller quickly. Your name and where you calling from? Or we'll miss this caller. We'll hope that you can call back 0776 089 713, or better still 0880 514 096. Your name and where you calling from?
I'm Stephen McCoy, calling for District Number 9, Montreal County, member of the National Reform and Extension of President George Managua.
Okay.
I want to say good evening to the studio guests. I listen to the lecture, and I want to say something because especially the Carol Center, everyone is talking about how those are benefited, especially last academic year. I attended a workshop, at the Carol Center DFA. The workshop taught me a lot of things, especially from some of our fancy. I understand a lot of things, and even the in-laws who gave me at the time up to now, they have that booklet. I can go through it, you stay and I get it on time. So I want to ask our legislator, and if you have them, recognize these people, empower them for good and one better in the country. One for the legislator to look into them and help them. So I want to say thank you to my brothers that in class, community studio, and continue with the publicity. Tomorrow, the after tomorrow, we will be better, society, especially when it comes to the mental area. Thank you very much, and thank you for putting it on.
Many thanks. Let's take this other call on the line. Your name and where you calling from?
My name is Maria Yafala, joining from Bon County.
Let's hear from you, sir.
I appreciate Lord School of Steve again for the collaboration. But then my concern has to do with those that are mentally ill. Some are going to the point of being crazy, as they can say. Do they have any treatment for those that are already gone by, or do they have special places that they can keep them and mentor them?
Okay. Many thanks. I'm sure they'll respond to your concerns and your questions. They are taking notes 0776 089 713, or better still 0880 514 096. That's the numbers to call. Your name and where you calling from? Yes, sir.
I'm George. I'm George Rogers, calling from the Rabofi Highway.
Okay, let's hear from you.
I monitor the show, and I'm now happy that I have one of my own, especially who is now preaching and teaching mental mental health illness. Then I'm so proud of you and about the program we're taking in Abuchi. Our legislators endorsing the hierarchy in our turning the direction to this project. That's like what we did off.
Thank you very much. Let's take this other call on the line quickly. Your name and where you calling from? No? Okay, we missed that caller. 0776 089 713. I'm sure only five more calls we can take and wrap it up quickly. 0776 089 713. Your name and where you calling from? Hello?
I'm Sonny Botu, calling from Grand Chile.
Let's hear from you, sir.
Okay, so thank you to the studio guest. My attention is June to the bipolar disorder that you were discussing. I want to know whether there is a specific food that somebody with that bipolar disorder is supposed to eat.
Okay, he wants to know that. Okay, they are taking notes, they'll respond. 0776 089 713, or better still, 0880 514 096. That's the numbers to call. And you are live on the Bumper Show right on the OBC 99.9. Today we are looking at mental health. I'm sure you heard about that, but we've been asking as to some of the symptoms people do face with. Let me know where you calling from quickly. Hello? Hello? Okay, this call is not ready. Let's take this other call up. Your name and where you calling from? Okay, sir. Let's hear from you.
Yeah, my concern here, my brother. I am feeling to the government. I need the room from cancer to sweat.
We are not talking about road. Oh, my people. Why you wouldn't listen to the radio and see or listen to the focus of the discussion before you can, make your call? Oh, that's unfortunate. 0776 089 713, or better still 0880 514 096. On the two more calls and I'll wrap it up. 0776 089 713, or better still 0880 514 096. But while we still await the two more calls, let's just respond to some of the concerns quickly.
Okay, I would take the first question when the guy talked about whether there is treatment for people he referred to as crazy people, and whether there is a special place to put them. I just want to say to him, do not refer to people as crazy people. It is wrong. It is unfair. We don't do that, and we're asking people to stop doing it. They are persons with mental health issues. So they have a condition. Yes, the condition can be treated. There are treatments all over the place. The treatment can be drug treatment, can also be psychotherapies. And we have mental health professionals in country who can provide just the right support and treatment for them. And you talk about a special place, again, we are working against keeping people in special places. Best practice, the evidence does not support that, has been very effective. Community-based mental health, that's the way to go. Integrating mental health services into routine care, general health care, that's what we are doing. Focusing on other areas and different platforms like across HIV, across non-communicable diseases, tropical diseases, that's what we're talking about. So please, we don't approve of special places, institutionalization for people. Thank you.
Okay.
Yeah.
WHO.
Like I said earlier, to you, our listener out there, I can assure you, with the right medications and support, some may need medication like this, some just need to be talked to. People that you see out there, whether they are eating on the garbage, whether they are, which is a severe form of mental health issues, they can be brought to a normal level of functioning, and they can function, cook their own food, wash their own clothes, do everything that you and myself can do. Believe me, if you really want to put that to test, look at one person, come to Grand, and maybe we just go over a little bit of a research or something over time, and you see every one of them that you see in the street there, yes, they can be brought to some level of functioning. I have worked like all my life with some of those people, and some of them that I see walking out there are people that I have worked with. They were now cooking their own food, they were now doing everything. But why you saw them back there is what? The community. Their own people rejecting it. Their own people rejecting it, not helping them with their medication, not helping them back, to reintegrate into the society. If you go to Grand today, you have more than 25 persons lavishing there. Their relatives or whosoever person that have brought them have just left them there.
Yeah,
So, yes, the common concept is finding a place to put these people. Now, you don't call people with pressure people or this group of diabetes people. You don't do that. So you start calling these people crazy people. They do have mental health issues, right? Like Ben said. But they are people. See the humanness in them first. All right? If I may ask you, in fact, if you look at our accident statistics, how many people with mental health issues that you see on that list? Quote unquote, you and myself, who are the normal people, are the people who can't get knocked down all the time. Because why? Of our lack of concentration and the way we see things.
Okay, let's take this caller on the line. I'm sure that's the last caller. Your name and where you calling from?
I called previously and asked about the food that somebody was powerful that I'm supposed to eat.
Okay, sir. We are going to answer your question right there. Somebody with bipolar can eat if it is not their taboo. If because we do have taboo and other things, I mean, if they are not reactive or allergic to those food, they can eat the normal food that you and myself can eat. But they have to be exempted from taking excessive alcohol and those risky behaviors that expose them to having episodes of mania, either mania or depression. Because some of those things, especially the alcohol, they are depressants. They have the ability to depress the centers and actually put them into crisis.
Okay.
So you can do that.
Okay, this final one. Let's squeeze this one in. Your name and where you calling from? Yes, sir.
I'm calling from Ghana Bay. I'm just
Okay.
Yeah, I have my sister someone is suffering from epilepsy.
Mm-hmm.
Yes, because what can happen to him when you go to bed, that's the time you start taking. You see, but when you go to bed, you can be normal.
Okay. That's the experts. Tell us something about that.
So epilepsy is a condition that can be treated, and people with epilepsy can be brought back to normal functioning and they can live their normal life. In fact, there are some people with epilepsy, when treated over the course of 2 years, they can go out of symptoms. They don't have epilepsy anymore. So you need to help them to continue because they need to take that medication over the time. So epilepsy can be treated. All right, it shouldn't be the cause of anybody, abusing another person or whatever thing. No, epilepsy can be treated. You have a Grand Hospital, you have all the county hospitals. You go to Redemption, you will find mental health clinicians there. All of the national hospitals in all of the counties, you have mental health clinicians working there. So wherever you find yourself, if you have someone with mental health issue, with epilepsy, every other thing, just take them there.
Okay.
They are going to be treated.
Finally, gentlemen, you didn't tell us as to who is your keynote speaker and who are those you are expecting to attend the program
Okay.
on Mental Health Day, World Mental Health Day. So
Okay.
finally, so we can go.
So yeah, well, that was the last thing I was going to talk about. The last program, which is the indoor program, and that will be on the 12th at the Ministry of Health. Again, invitation is extended to you. The keynote speaker will be Mr. Dawa Jala,
Okay.
country director for the Carter Center, and I think the office of the First Lady, will also be has been invited.
Okay.
So international partners, you see them, MSF, PIH, and some training institutions, Mother Patern, WHO, and so all the key partners. And high on the agenda will be cultivation for users' hope. I say that particularly because that's the mental health service users in the organization that is in the forefront of this. So that program will be more of an opportunity to deliver more information and talk more about investment opportunity. How can we increase access, and how can we increase investment, and calling on partners more to do this. So we will try as much as possible to go beyond the say, you know, we don't want to keep preaching to the choir, and that is just getting in a room all the organizations and partners that have the same focus. Like we want to go beyond that, the people who are not with us yet. So we want to invite a lot of people who are not open to this, who do not understand the full context and how that's what we want to bring.
Okay,
Bring
and a final message for you.
team.
Well, looking at the limited resources that we have in this country, I'm really talking to community leaders, the religious leaders, traditional leaders, that in their community they should help to protect people with mental health. It should not exploit them, not make them to work overtime for just a little food or something, not to abuse them. All right. Rather, they should try to protect these people, try to see where they are treatment to take them there, and we hope, you know, going forward, we are going to have more engagement with our legislators to actually speak the language that they understand, to actually look at investment.
Okay, gentlemen, thank you very much. We are Mr. S. Benedict Dawson. He's the program lead for mental health at the County Center, and Mr. Bacon Dua. He's the non-communicable disease focal point at the WHO. Gentlemen, thank you very much for making yourselves available on this platform.
Thank you very much, Soba. It was a pleasure.
And I think the message here is that we shouldn't treat people with mental health with disdain. We shouldn't discriminate against them.
Exactly.
Gentlemen, thank you very much for the knowledge.